Hello and welcome to the State of Montana Benefit Plan or State Plan New Employee Benefits presentation. This presentation is a supplement to the New Employee Benefits book that you will receive in the mail from the Healthcare and Benefits Division or HCBD. We highly recommend that you carefully read the New Employee Benefits book and gain an understanding of the benefits and choices available from the state plan. The HCBD website at www.benefits.mt.gov also has valuable information to help you better understand state plan benefits. If you have any specific questions that are not covered during this presentation, please call or email HCBD at 800-287-8266. TTY number is 406-444-1421. or email to benefitsquestions@mt.gov. The State of Montana Benefit Plan or State Plan is self-funded. The funds that pay for the plan member expenses and benefits come from two places. The first is the employer contribution, which is a per-month contribution paid by the State of Montana on behalf of each employee. This amount is set by the legislature and funded by income from state taxes. The other place that money comes from is you, the plan member. Your monthly benefit contribution is calculated based on who is enrolled on your plan and which optional benefits you have elected. When you go to the doctor or dentist or fill a prescription for a medication, a bill is then sent to one of our third-party administrators or TPAs. The state plan contracts with these TPAs to process and pay claims based upon the benefit design and coverages of the state plan. A small amount also comes out of the state plan to pay administrative costs such as HCBD staff salaries and contract fees to the TPAs. Administrative expenses represent a very small amount of our yearly spend. Any remaining funds are used to fund plan reserves. Plan reserves are used to offset and save for unexpected costs that the state plan may be responsible for, such as federal or state regulatory mandates and larger than expected claim costs. In order to take full advantage of state plan benefits, you will need to enroll in benefits within 31 days of your date of hire. If you enroll in benefits within the 31 days of your date of hire, your coverage will be effective as of your hire date. Start by going to www.benefits.mt.gov to begin the enrollment. If you don't enroll in benefits during the initial enrollment period, you automatically waive coverage. As an employee, you can enroll in any core benefit after the first 31 days, and your effective date will be the first of the month following the date that you enroll. But you will miss out on enrolling in the optional benefits offered. Those are things such as dependent coverage for medical, dental, and vision hardware, life insurance, and dependent life insurance, as well as long-term disability and flexible spending. If you do not enroll within the 31 days of your date of hire, you will only be able to add dependents to your state plan benefits if you happen to qualify for a special enrollment period or during the annual open enrollment period, which occurs for 2 weeks each fall. To get started with your new employee enrollment, visit www.benefits.mt.gov and click on the New Benefits Enrollment green button. You will begin by entering your username and password. If you are accessing the State of Montana network, you will automatically enter this system and will not be required to register. However, if you are a first-time user and accessing the system outside of the State of Montana network, from home, for example, you will go through a registration process of setting up a username, password, and answering security questions. Our company key is State of Montana, lowercase, no spaces. Once you've completed your registration and accepted the terms of the system, you will be led to a home page that contains the Start Here button. Clicking the Start Here button will begin your enrollment, and you will then follow prompts to enroll in your benefits or to waive coverage. You must make your elections by the deadline shown on the calendar, or coverage will be waived. Remember, if you don't complete your enrollments during your initial enrollment period, which is 31 days from your date of hire, you will automatically in core benefits after that first 31 days, and your effective date will be the first of the month following the date that you choose to enroll. But remember, you will miss out on enrolling in the optional benefits like dependent coverage for medical, dental, and vision hardware, life insurance, dependent life insurance, long-term disability, and flexible spending. You may also enroll in your benefits using your mobile device. You may download the My Choice mobile app, but then in order to sync the My Choice mobile app with the enrollment system, you will need to log on to the system and get the access code, which is available on the home page of the enrollment system. The next page is the Dependent Information page. If you intend to enroll a dependent on state plan benefits, including spouse supplemental life, they must be listed as a dependent in this section. Please be aware that if you enroll a spouse or domestic partner or dependent child or children, you'll be required to provide documentation which verifies their eligibility as your qualified dependent. After completing, click Next to proceed. On the Proceeding tabs, you will be prompted to make your benefit elections. As you make your elections, each page opens with a blue box that contains very important instructional information at the top. Please read this blue box at the top of each page to be certain that you are accurately completing each of your elections. You will be asked to make an election for each state plan benefit available to you, for example, medical, dental, vision, life, etc. You will begin with the medical plan. If you wish to elect the benefit, simply hit the Select button by the benefit and then indicate the coverage tier if you would like to choose for each benefit. For the medical plan, you would indicate which dependents you would like enrolled on the plan, and this is known as the coverage tier. As you make your elections, you'll be able to track them and the associated costs along the left-hand side of the screen. Again, make sure that you pay close attention to the information contained in the blue box at the top of each enrollment tab for important information about each benefit. When you've completed all of your benefit elections, you will be prompted to review your elections and the associated cost for each one. Keep in mind the associated cost for each election is a bi-weekly amount, and that will be taken from your paycheck. In order to complete your enrollment, you must click Approve. If you do not approve, your benefit elections won't be finalized and you won't be enrolled in the state plan benefits. Once you do click Approve, you will be given the opportunity to print a benefit summary of your elections. This benefit summary is also available to you at any time by logging into the enrollment system. Keep in mind, the system is available to you at any time of the year, and you will be using it to update beneficiaries, make mid-year changes, review your enrollments throughout the year. You may visit the HCBD website frequently to see our updates and current plan information regarding your state plan benefits. Now let's talk about the state plan benefits available to you. This information will be helpful to you as you complete your elections using the enrollment process we discussed. When a new employee enrolls in benefits, they must enroll in core benefits. Core benefits include medical, which includes prescription drug coverage and coverage for one routine annual eye exam, dental, and basic life insurance coverage for the employee only. As a new employee, you have optional benefits available to you for an additional out-of-pocket cost. You have the option to add a spouse or domestic partner and/or dependent child or children under the age of 26 to medical, dental, and vision hardware benefits. If you enroll a spouse or domestic partner and/or dependent child or children, you will be required to provide documentation upon enrollment their eligibility as your qualified dependent. You are also eligible to enroll in optional benefits. These are medical and dependent care flexible spending accounts, extra life insurance for yourself and dependents, accidental death and dismemberment, and long-term disability insurance. See your new employee benefits book or visit the HCBD website for more information regarding optional benefits. This slide shows the monthly cost of the state plan coverage for medical, dental, and vision hardware benefits for yourself and any dependents that you wish to enroll. The employer contribution amount is $1,054 per employee per month. As a new employee, you may have the opportunity to participate in the Live Life Well incentive program and earn the incentive toward your monthly benefit contribution for the upcoming next plan year. Watch for important information regarding how to earn the Live Life Well incentive, and we will also review it in this presentation. You may also look at your new employee benefits book or visit the HCBD website for more information on the Live Life Well discount. As a state plan member, you and your covered spouse or domestic partner and/or child or children receive medical benefits as defined by the state plan. Listed on this slide is a summary of the copays, deductibles, benefit percentage amounts, and the maximum out-of-pockets associated with the medical plan when you receive services from a participating provider or facility. All your deductibles and maximums are based on a plan year, which is January 1 through December 31. Again, please review your new employee benefits book for complete details on medical plan cost sharing. Before you receive provider, facility, dental, or vision services, it is always a good idea to double-check your provider is participating with the plan. You may consult with your new employee benefits book on the back cover for a summary of all contact information. Or you may visit our website at www.benefits.mt.gov and then click on the service that you're seeking, whether it be medical, dental, etc. You may then check on the provided website for each provider or call them directly. This slide reflects the provider search capability for in and out of network participating providers and medical facilities. If you're a non-participating provider or facility that is used in Montana, you may pay the cost sharing shown previously and the state plan will pay a fair rate for your care. But the non-participating provider will balance bill you for more, and you would be responsible for this balance bill, and it will not count toward your deductible or your maximum out-of-pocket. If you happen to use an out-of-state, non-participating provider or facility, the cost sharing is shown on this table. Please remember these amounts are separate from the deductible benefit percentages and maximum out-of-pockets that are allowed for participating and non-participating providers and facilities in Montana. As part of the medical plan, in addition to your medical benefits, you receive one routine annual eye exam and a $10 copay with a participating provider, prescription drug coverage, and the use of all Montana health centers at no cost. Allegiance Benefit Plan Management processes our medical claims for the state plan, and Cigna provides the vision processing for the state plan. Navitus Health Solutions processes the prescription drug claims. Remember, it is the state plan that decides your rates, out-of-pocket costs, and coverages. You will receive an identification card in the mail from Allegiance, Cigna, and Navitus Health Solutions within 2 weeks of your enrollment. If you elect to participate in flexible spending, you will also receive a debit card from our flexible spending administrator. The website for Allegiance Plan is www.askallegiance.com/SOM. From this site, you may create a login and review your explanation of benefits or EOBs, review your state plan benefits, locate forms, find a provider, and more. Employees and covered dependents over 2 years of age who are covered by the state plan can use any of the Montana health centers. The state plan has health centers in Anaconda, Billings, Butte, Helena, and Missoula. The Montana health centers are much more than urgent care. You can make a Montana Health Center doctor your primary care provider. The Montana Health Centers provide the same kind of services that a regular doctor's office provides, and if you already have a primary care doctor, you can still use the Montana Health Centers for no-cost physicals, health screenings, lab work, vaccines, and more. Call and ask the Montana Health Center if you have any questions about what kinds of services are available. You can click on the web link to access the website for the Montana Health Centers. The Montana Health Centers are operated by a company called Care Here. The state pays 100% of the costs associated with the care that plan members receive at the Montana Health Centers. This means that any services you receive at the Montana Health Center are paid in full by the state of Montana plan. You never get a bill. However, please be aware that services received outside the Montana Health Centers apply to regular state plan benefits, even when the Montana Health Center makes the referral. To make an appointment, visit www.carehere.com and register. If you are a first-time user, the system will ask you for a code. The code for the State of Montana plan is MANA9. You may also call 855-200-6822 for assistance, or you can use the Care Here app, and you may find it by searching Care Here in your app store. The state plan does not provide coverage for any work-related illness or injury. This includes access to the Montana Health Center. If you or anyone covered on the state plan, including dependents, gets hurt or sick while working, the state plan will not provide coverage even if you or your covered dependents have a signed work comp waiver. You'll want to make sure that you have proper insurance coverage in place to cover work-related injuries. As a state of Montana employee, you are covered by workers' compensation insurance. Navitus Health Solution is the state plan's pharmacy benefit manager for the prescription drug plan. With Navitus, you have a retail network pharmacy 34-day option for filling prescription medications, as well as a retail network or a mail-order 90-day option. Lumicera is the preferred specialty pharmacy for specialty medications. You will want to visit www.navitus.com to get information regarding the state plan's participating network of pharmacies, as well as review the formulary, which is the listing of covered medications, and the tier in which they are covered. Here's a look at the prescription drug plan copay structure. Notice that if you are on a maintenance medication or a medication that you take every single day, you will save money by using the 90-day fill option as you receive 3 months of medication for just 2 copayments. $0 preventive products are certain preventive medications that are zero at either retail 34-day supply or retail mail order at 90. Tier 1 preferred generics and some lower-cost brand products are $15 for the 34-day supply and $30 for a 90-day supply. Tier 2 are the preferred brand products and some high-cost non-preferred generics, which are a $50 copay for 34-day supply and a $100 copay for 90. Tier 3 are the non-preferred products and some high-cost preferred generics. They are paid at a 50% coinsurance for either 34 or 90-day supply, and the coinsurance you pay on this level does not apply towards the maximum prescription out-of-pocket amount, which is $800 per family, $1,800 per individual, or $3,600 per family. Tier 4 are the specialty drugs provided by Lumicera, which is the preferred specialty pharmacy. These are a $200 copay. If you get your specialty medications from a retail network, non-preferred specialty, or an out-of-network pharmacy, there's a 50% coinsurance, which again doesn't apply to the maximum out-of-pocket amount. The Navitus Health Solutions website is www.navitus.com. You have the choice to fill your maintenance medication to get a 90-day supply at a local in-network pharmacy or at any one of the state plan's 3 participating mail-order venues. Costco, and you do not have to be a Costco member, MyRx, or Ridgeway. When you fill a 90-day supply of medication, you can get the 3-month supply of the medication for just 2 copays versus 3. Please consult the new employee benefits book for details or visit the HCBD website for more information on the prescription drug plan. And here's a look at the Navitus site, www.navitus.com, where you may register, log in, review formulary medication listings, locate member pharmacies, and much more. The prescription drug plan, as I said, has a separate maximum out-of-pocket amount from the medical plan. The maximum out-of-pocket for prescription drug plan is $1,800 for an individual and $3,600 for a family. Tier 3 and Tier 4 coinsurance amounts don't apply towards the maximum, and the maximum out-of-pocket is based on a plan year January 1 through December 31. Delta Dental is the TPA that processes the state plan's dental claims. Remember, it is the state that decides rates, out-of-pocket costs, and coverages. Delta Dental provides members with 3 provider networks: Preferred Provider, Premier Dentist, and Non-Network Dentist. Choosing a preferred provider results in you, the member, paying the least amount out of pocket. Contact Delta Dental by phone or online at www.deltadentalins.com/State of Montana. You may ask questions about claims, billing, request a cost estimate, or check the network status of your dental provider. You can also refer to the new member benefits book or the HCBD website for more information on the dental plan. When you log in and click on Delta Dental's website, it will take you to the Delta Dental site for the state of Montana specifically, and you may set up an account, a login and password, and you may search your claims, find a provider, request an estimate, and read dental wellness articles. This slide shows the reimbursement amounts set by the state plan for dental services. State plan has an annual maximum of $1,800 per employee per calendar year. The dental plan applies a $50 deductible per enrollee or $150 deductible per family per year. This is provided to the basic and major benefits section. Please note, the diagnostic and preventive benefits are not subject to the deductible. Remember, every member covered on the medical plan receives 1 routine vision exam per year for a $10 copay. The vision hardware plan provides some reimbursement for frames, lenses, contacts, and specific add-on features for your glasses, and the vision hardware plan is the optional benefit elected by the member for a monthly cost. When you elect the vision hardware plan, please be aware that any dependent, whether spouse, domestic partner, and/or child or children, that you cover on the medical plan will be enrolled on the vision hardware plan if you elect it. Also, please check to make sure both your eye doctor and the store where you purchase your hardware are participating by visiting www.mycigna.com. Please be aware that you must re-enroll in the vision hardware benefit every year during open enrollment. Review the details of the vision hardware plan in your new employee benefits book or on the HCBD website. By clicking on www.mycigna.com, you may register and enter information on their site. You will be able to check your account, locate providers, review your benefits, and among other things, their website is available to you for yourself and dependents that you cover on the vision hardware plan. A flexible spending account, or FSA, allows employees to set aside a portion of earnings to pay for qualified expenses. Most commonly, these expenses are for medical and dependent care on a pre-tax basis. Money deducted from the employee's paycheck is put into an FSA and not subject to payroll taxes, which will result in payroll tax savings. You are eligible to elect and participate in medical and dependent care flexible spending accounts. The medical flexible spending accounts and the dependent care are both administered by ASI Flex. As an employee, you can set aside up to $2,700 for medical-related expenses. You have the ability to roll a maximum of $500 of medical flexible spending money over to the next plan year for use in that plan year. This money is for qualified medical, dental, and vision expenses for you and your dependents. You may check the ASI Flex website at www.asiflex.com to review a full list of qualified medical expenses. Dependent care flexible spending has a maximum contribution limit of $5,000 per plan year. This money may not be used for medical expenses. This is used for dependent care. Dependent care contributions must be used to pay charges associated with child care for children under the age of 12 or for qualified disabled dependent care while you work. For more information on flexible spending account options, refer to the New Employee Benefits book or the HCBD website. If you do elect to participate in either one or both types of flexible spending accounts, you will be charged a $2.26 a month fee for the administration fee that's associated with these flexible spending accounts. FSA reimbursement options include a debit card, which you will automatically receive if you elect medical FSA, online submission, smartphone or tablet, mail, or fax. If you elect to use the debit card, please be aware that you will still be required to possibly submit follow-up documentation showing charges that were submitted for a qualified expense. For more information regarding FSAs, check our website or visit the asiflex.com website. The asiflex.com website is shown here. Once you register, you may review your account summary, submit claims, review lists of eligible expenses, or turn in requested paperwork when asked by ASI Flex to do so. Every employee who enrolls in the state plan is required to enroll in the Basic Life benefit. The Basic Life plan is paid for by the employer contribution and gives you $14,000 of life insurance coverage. As a new employee, you may elect to participate in Employee Supplemental Life. The Employee Supplemental Life 1 plan allows you to elect life insurance coverage up to your annual salary amount without evidence of insurability, or EOI. That is available within the first 31 days of your date of hire. The Employee Supplemental Life 2 plan allows you to elect additional life insurance coverage over your salary amount up to $500,000 with EOI. The Spouse Supplemental Life plan is available to you if only you have selected Employee Supplemental Life and wish to purchase life insurance for your spouse or domestic partner. Coverage is available in $5,000 increments and is available up to the amount that you have elected for Employee Supplemental Life. Any amount elected over $10,000 is subject to EOI from spouse or domestic partner. As a new employee, you will be eligible to elect Dependent Life. Dependent Life provides you with $2,000 of life insurance coverage for a spouse or domestic partner and $1,000 of coverage per dependent child. You may only enroll in Dependent Life during your first 31 days of your date of hire, or within 60 days of getting married, or within 91 days of the birth of your first child. If you do not enroll during the times outlined, you will not be eligible to enroll at a later date. Accidental death and dismemberment is available within the first 31 days of your date of hire and is not subject to EOI. You may enroll with or without dependents in $25,000 increments up to a maximum of 10 times your annual salary or $500,000. With the exception of the Basic Life Plan and the Dependent Life Plan, all other life benefits may be increased or changed during open enrollment or at any time with evidence of insurability. These benefits are provided by the Standard Life Insurance Company. Every employee has access to guaranteed long-term disability insurance in the first 31 days of your date of hire. If you do not enroll in long-term disability coverage within the first 31 days of your date of hire, you have to wait until open enrollment to sign up, and you will be required to complete an evidence of insurability to be approved for coverage. In the event that you become disabled, insurance would replace 60% of your pre-disability wage starting 180 days after you become disabled. This slide shows the monthly out-of-pocket costs for supplemental life insurance policies available to you. Also listed are the monthly costs for accidental death and dismemberment. The Employee Assistance Program, or EAP, assists employees and family members by providing counseling services, 24-hour crisis help, and many other life balance resources. Call the number on the screen or visit the RBH website at www.myrbh.com with the access code Montana, capital M. You may access these very important benefits from the website or by calling them. Enrollment in the state plan is not required, and for additional information, please refer to the New Employee Benefits book, the HCBD website, or access the RBH website at www.myrbh.com. You have the opportunity to earn $30 per month off your 2021 benefit contribution by completing 3 activities: a state-sponsored health screening, being nicotine-free, or if you're not nicotine-free, completing an alternative activity, and completing and self-reporting your eligible next step activity. You may double your incentive if a covered spouse or domestic partner on your plan also participates and completes all 3 activities. Remember, all 3 must be completed to earn any incentive. Partial incentives are not available, and you have to complete all 3 activities between November 1 of 2019 and October 31 of 2020 to be eligible for the incentive in 2021. On these next slides, we will show you instructional pages for earning the incentive, and then we will go over each individual benefit in more detail. First, you can find instructions for how to complete the activities and check the status of your incentive activities at www.benefits.mt.gov/incentive. Next, to self-report your activities or check your incentive status, you may visit www.myactivehealth.com/SOM. You may also call MyActiveHealth at 855-206-1302 for help with your account or using their website. This is a screenshot of what the HCBD Live Life Well How to Complete Your Incentive page looks like. And this is the myactivehealth.com/SOM website. On this website, you will log in with a username and password for both you and an eligible dependent. You must each have separate accounts to self-report your nicotine status or the completion of an alternative program, and to self-report your next step activity. To earn your incentive, we recommend you schedule a state-sponsored health screening as soon as possible. Don't wait. You have 2 ways to access a state-sponsored health screening depending on where you live. You may either choose a day during the week that works for you and schedule an appointment for a health screening at a Montana Health Center in Anaconda, Billings, Butte, Helena, or Missoula. Or, if you can't make it to an on-site health center, we send a team from the Montana Health Centers around the state each year. These are called off-site screenings, and the schedule for all the off-site events is posted and ready for appointments starting in mid-January. Your appointment can be made at a health center any day that works for you, and you can find the full schedule of the off-site screenings and/or the instructions on how to make a health screening appointment at http://healthcenter.mt.gov/health screenings. You may click on this link to visit or schedule and make an appointment. Included in this slide shows the screen that takes you to health center screening schedules. Included in your state-sponsored health screening is a height, weight, and blood pressure measurement. You may also have a waist circumference taken, but that's an option and upon request only. Your blood will be taken, and a complete blood count, comprehensive metabolic panel, and lipid panel will be run. If you might have other lab tests that you'd like to add at the time of your health screening, you must bring doctor's orders or a prescription with those tests listed. Most tests can be added with the prescription at a Montana Health Center site. However, if you attend an off-site event, the only extra tests you may add are PSA, TSH, or HbA1c. Bring your prescription, as health center staff cannot complete any lab tests in addition to those listed here without it. As a part of earning the incentive, members must self-report if they are nicotine-free, or if they're not nicotine-free, that they have completed an eligible alternative. There are two eligible alternatives, either completing a nicotine cessation program or a nicotine education session. You must self-report your nicotine-free status or completion of an eligible alternative at myactivehealth.com/SOM. The first alternative is completion of a nicotine cessation program. You can complete any nicotine cessation program, but we have two available to state plan members at no additional out-of-pocket cost. The first one is available to members that are able to visit a Montana Health Center. The second is available to anyone who lives in the state of Montana, which is the Montana Tobacco Quit Line. The second alternative is a completion of a nicotine education session. This is simply a visit with your provider for the purpose of discussing your nicotine use or exposure. This is appropriate for members who are not quite ready to quit using nicotine, or who are exposed to nicotine rarely or via secondhand smoke. You can find out more information about these alternatives at benefits.mt.gov/nicotine-free incentive. To summarize, on this particular benefit, in order to be considered nicotine-free for this part of the incentive, you must not use any form of nicotine, which are cigarettes, chewing tobacco, pipes, cigars, vaporizers, or nicotine replacement therapy like Nicorette gum or lozenges. If you do use any form of nicotine product, you must complete one of the two listed alternatives. As a part of earning the incentive, members must complete an eligible next step activity. This is a complete list of eligible next step activities summarized but also available at www.benefits.nt.gov/incentive. This slide has very small print, and its only intention is to show you that there are many different options for our members to choose from for this activity. Remember, you're only required to complete and report one eligible next step activity. And there is a whole list of these activities in addition to options we have detailed here. Choose to complete one and self-report whichever one works best for you. Lastly, regarding the Live Life Well incentive, the state plan offers the incentive program to all plan members and their enrolled spouse or domestic partners. If you think you may be unable to meet the standard of the incentive program, you may qualify for an alternative program or different means to earn the incentive. You must contact the Healthcare and Benefits Division, HCBD, as soon as possible at 800-287-8266 or email us at benefitsquestions@mt.gov. We will work with you, and if you wish, your doctor, to design a program with the same incentive that is right for you. Open enrollment is at a time each fall when the state plan provides information about any changes in benefit contributions or benefits coming for the next plan year. It is also the only time to make changes to benefits like opting back into the Vision hardware plan or renewing your flexible benefit accounts. Any changes you make are done online and take effect January 1st of the following year. We encourage you to watch an education presentation and make sure that you're up to date about any changes coming in your benefits for the next plan year. Here are some ways that you can make the most of your state plan benefits. Doing these things helps you and the state plan save money. Make sure you're using participating providers, and you may visit the HCBD website for links to participating providers and in-network pharmacy directories. Review your medications. Some medications qualify for the 90-day fill at a retail or mail-order pharmacy. When you fill 90 days at a time, you will pay 2 copays versus 3 and receive 3 months of medication. Use a Montana Health Center whenever you can. Remember, the Montana Health Centers provide primary care at no cost to you. Take advantage of no-cost wellness and prevention programs available to you. Participation in these programs could reduce the amount of your monthly benefit contribution. And finally, please be aware that our vendors may contact you with informative, cost-saving programs for you to participate in. They will never solicit your personal information, and your decision to participate is optional. www.benefits.mt.gov is a great resource for you to find out what you need to know as a state employee and your benefits. This website is where you enroll in benefits, make plan changes during open enrollment or update your personal information, report your wellness activities, and just stay on top of all things benefits related. If you have questions about claims, bills, EOBs, or explanations of benefits, participating providers, individual count information, what is covered, pre-authorizations, or how to make a Montana Health Center appointment, you should be contacting our third-party administrators like Allegiance, Navitas, Delta Dental, and the Standard, or the Montana Health Center. You can refer to the back of your new employee book website for websites and contact numbers. But if you have questions about eligibility, who's covered on the plan, mid-year changes, or payroll deductions, special enrollment periods, open enrollment, or the Live Life Well Incentive Program, you should be contacting HCBD at 800-287-8266 or TTY number at 406-444-1421, or you can email us at benefitsquestions@mt.gov, or of course visiting our website at. Remember, before you receive provider, facility, dental, vision, or prescription services, it's always a good idea to double check that your provider is participating with the plan. You may consult your new employee benefits book on the back cover for a summary of all contact information, or you may visit our website at www.benefits.mt.gov and click on the service you're seeking, medical, dental, etc. You there may check the provided website or call them directly. Thank you for attending the new employee benefits presentation.